Those with long memories, number 10 summits about all sorts of issues, they tend to come and go with not much actually resulting from them. Do you think this meeting yesterday will have been any different?
I think this was definitely a be seen to be doing something meeting rather than actually just do something. To a certain extent, on a kind of public affairs strategy level, it was a sensible thing to do. Those talks would have been going on anyway, but Sunak needs to be providing the public with some sort of reassurances. I mean, what's going on in the NHS is absolutely catastrophic, actually, and it's beyond a normal winter crisis, which would be bad enough. But, to be fair on him, I'm not sure it's entirely his fault. I think this goes much further back than simply high levels of flu and even the strikes.
Exactly what I was going to ask you about next, David Maddox, actually. This is a crisis that is decades in the making, isn't it? I mean, obviously, we've got a lot going on right now with the nurses' strike and the twin-demic, but really, there are problems right to the very core of the NHS and have been for years.
That's right. And the problem is that governments are always, of any colour, are always terrified about really properly addressing the NHS. The biggest problem really is the refusal and the resistance to have any kind of private sector involvement to really kind of reform it in a way that actually increases productivity in the NHS and actually allows people to kind of get proper healthcare. I mean, the NHS is great, especially on the kind of emergency end of things. And, we all have stories of wonderful treatment from the NHS. But, the reality is it's not, as people claim, the envy of the world, because it's not copied anywhere else in the world. If you look at Europe, they have a kind of mixture of private and public. Obviously the Americans have a very controversial system, even after Obamacare. But it's, this is the essential problem. And of course, the one thing that always is said, and I noticed in the papers today, they always say it's underinvestment. It's not underinvestment. We have record levels of investment. It's massive inefficiency in an enormous organisation that's just not performing.